Today I'll talk a little bit about the policies behind drug residues and then some of the numbers that we have out there as far as where we're seeing the violations. To start with, the agency's mission is to protect the nation's meat and poultry supply and egg products to ensure a safe, wholesome, unadulterated, properly packaged and labeled product. So residues are of great concern for us because that could lead to potentially adulterated, unsafe food in commerce. The agency gets their regulatory authority over residues because the United States Code, Title 21. We have the Federal Meat Inspection Act, which came about after Upton St. Clair's book called The Jungle in 1906. So in 1907, the Federal Meat Inspection Act was passed. And then in 1957 came the Poultry Products Inspection Act. And then 13 years later was the Egg Products Inspection Act. So that gives us our authority to control residues and the animals that are presented for slaughter. And additionally, in Title IX, we have our Code of Federal Regulations, which are the standards that we hold the establishments to. And these parts that are listed are parts that deal with antemortem and postmortem dispositions, authority over animals that you suspect could be treated or could have recently been treated or you suspect might contain drug residues based on clinical presentations, injection site reactions, things like that based on professional experience. And also it defines some terms as far as calves, as far as suspect animals. It addresses also in 318 that the FDA has established tolerance levels for certain chemicals and drugs, as well as the EPA, and so we are responsible for abiding by those tolerance levels. And then Part 320 holds the establishments responsible for maintaining documentation on the animals that are presented for slaughter, on the animal's origin, name, address of the owner or supplier. So that is a requirement that we have in the regulations. 381 is just everything that I just stated for livestock is listed there for poultry, so the poultry regs are in 381. And then 417 is the HACCP requirements, and establishments are required to determine if drug residues are hazards that are reasonably likely to occur or that are not reasonably likely to occur, and they need to support their decision. So by far, most of the livestock slaughtering facilities will determine that residues are likely to occur, and then they will have some type of program in place to prevent them from occurring. The areas and the establishments that do not have a program in place according to 417, those are really some of our challenging establishments where they don't have a program in place, and so the agency needs to hold them accountable under 417 to get something in place so that we can prevent the drug residues from entering the meat and that's presented in commerce. We're responsible for overseeing, it says 6,200 federal plants and 800 of those are livestock slaughter. We inspect a lot of birds every year and egg products. We're also responsible for custom exempt facilities and ID warehouses, import houses. So FSIS has a really big responsibility when it comes to drug residues because we oversee a lot of areas where we can detect the residues and prevent them from being a part of our meat and poultry supply. Other things that we do are set the food safety standards and other standards regarding wholesomeness and labeling. We're responsible for domestic and import inspection, emergency response, investigations, enforcement activities. We also do a lot of outreach programs to try to educate the community, and we've just recently in the last few years asked establishments to have food security plans, food defense plans. And they're not required yet, but they are something that when we're out there doing our assessments that we do ask them to provide and encourage them to initiate if they don't already have one that they're following. When we look at the production classes under FSIS regulatory authority, these are all the amenable species, and cattle, swine, and poultry are by far the ones that we inspect the most of. And we know that cattle and swine are where we see a lot of our residue violations. So the National Residue Program, it was put in effect, it's been in effect since 1967. and it provides a variety of sampling plans to prevent residues from entering the food supply. And it's also a national data system on the occurrence of chemical residues, and that helps with risk assessment, enforcement activities, and educational opportunities. And so this is just a breakdown of pretty much what I just said. Really, with the National Residue Program, we want to verify that the plants are fulfilling their responsibilities under HACCP and their responsibility to produce a safe product. And the National Residue Program, it's really an interagency program. FSIS has the responsibility to prevent chemically adulterated product from entering the food supply, and we can control that at the establishment. So that's the only place where we really have authority to control that. And the FDA is responsible for establishing the tolerances along with the EPA and for approving the feed and drug usage. And they're able to take their enforcement activity and on to the farm. So we really need to work together so that we can detect it at the inspection and we can trace it back to the farm. And traceability is really everybody knows that's the key factor to protecting the meat and poultry supply and to tracing back to the animal's origin. Ideally, FSIS would do random sampling and targeted sampling on animals. They would detect violations. They would consult the establishment, plant management, to get the animal's origin, the traceback information, and then our Office of Policy and Program Development would take that data, they would upload it into the residue violation information system, make all that information available, so then the FDA can access that information and they can investigate the source of drug. And the FDA, they do investigate veterinarians, they investigate farmers, they investigate feed suppliers to try to determine the source of that drug and who gave the animal that drug. The problem is that not all of the animal's original identification that it comes with to the slaughter facility is actually able to be used to trace the animal. If you have an ear tag like that picture there that has the producer's name on it or that has the name of the feedlot, that'll get you a little further than if you just have a back tag from a sale barn or that was applied at the establishment. The back tag really doesn't tell us anything. It doesn't tell us where that animal came from, who the producer was. And the ear tags, the metal ear tags, they can be advantageous sometimes when you have access to records that go to those ear tags. But there are a lot of times where the original identification that comes with the animal just isn't enough. And so the RFID tags that contain all of the animal's information, those are really ideal to be able to trace back to the animal's origin. So those are some of our challenges with the traceability, and I believe part of the reason why there was a push for a national animal identification system. It would benefit something like this. For the residue sampling plans, we have residue sampling plans for those domestic species that we are slaughtering. And there is scheduled sampling, and then there is inspector-generated sampling. The scheduled sampling is the directed sampling. The establishments receive a list at the beginning of the month of the type of animal that they are to test and the tissues that they are to collect. And on that form, it also identifies what those tissues will be tested for, whether it's sulfa drugs, whether it's antibiotics of some other sort, whether it's anti-inflammatories. And so that tissue will be sent to the appropriate lab that does that testing. Everything is specified on that form. And the implant personnel's job is just to randomly select a carcass to obtain those samples from. The inspector-generated sampling is what occurs with animals that you suspect on antemortem inspection or post-mortem inspection that could have recently received treatment. And so that is just targeted sampling, and we receive guidance through the regulations, the directives, the notices, and the notices and directives are being revised yearly, sometimes more frequently, to provide the best guidance to the implant personnel. This is a list of some of the compounds that were found to be at violative levels during the 2010 data. And the one thing to remember is that antibiotic residues They are a very big concern. That's by far what we see the most violations in. But there are also some other drugs like flunixin and some of the other anti-inflammatories that could be present in animals at violative levels, but we're only doing our pre-screening test in plant for the antibiotics. So we might need to start encouraging in-plant personnel to really determine, do they really believe the animal with the prolapse was treated with an antibiotic, or do they believe it was treated with an anti-inflammatory, so that we can be sure our tissues go to the correct lab to be analyzed. There is the FAST test that we perform in plant. That's the FAST antimicrobial screen test. It is essentially a microbial inhibition test, and this is what it looks like. The example on the right is the preferred example. Ideally, you have a FAST plate that has purple agar on it. You inoculate it with a bacterial a spore, and then you set your neomycin disc on the edge of that plate, and you have your swabs that you have swabbed the kidney with, and so it has the beef kidney juice on the ends of those swabs, and you place them so that they radiate away from the neomycin. And then the spores will grow, and that will leave a yellow film on the plate. The area of the neomycin, you will have a zone of inhibition. And then if you have a zone of inhibition around the swabs, that's your presumptive positive that there was an antibiotic in that animal that prevented the spore growth. And so we've recently transitioned from the FAST plate, which you have to wait at least 6 hours to read it, and at max 24 hours, to the kidney inhibition swab test. And it is basically the same principle as the FAST test, but it's a more rapid detection. You can detect antibiotic presence in 3 hours. And this is done in a test tube. It's kind of like a culturette. You unscrew it, you take the cotton tip applicator out, and you put it into the kidney. You let the kidney juice get on it. You stick it back into the culturette. You push it down into a little bit of buffer solution, and then you allow that combined solution of the kidney juice and the buffer to go down and touch the purple agar. The purple agar is inoculated with a bacteria, and in the presence of the beef juice, the bacteria will proliferate and produce an acid that changes the agar yellow if there's no antibiotic present. If there is antibiotic present, it will prohibit the microorganisms from proliferating, and so the purple agar will stay purple. And so this is the latest method that we are using in the plants to look for presumptive positive antibiotic tests, antibiotic presence. If we look at the residue sampling results, this is for the cattle from 2005 through 2010, and the orange is 2006. And the agency in 2006, they started management controls to include residue testing. So they started really encouraging that the IICs take a look at the animals, and those animals that meet the criteria to be fast tested are fast tested. And so that's one reason why we might see that large increase from years from if you look at previous data, the numbers weren't even that high. And then the reason that the numbers are even higher beyond 2006 is that in 2008 we have our district veterinary medical specialist position, and in 2008 they started giving more responsibilities to the DVMS regarding residue and residue prevention. And so the DVMS started going around to all these plants and encouraging individuals in the plant to do more fast testing and to do more KISS testing. And then in 2009 the notices were issued regarding repeat violators. And if we look at the swine, it's similar numbers in 2006. Since 2006, there's gradually been an increase in the number of tests from inspector-generated samples. If we look at the National Residue Program for the scheduled samples, on here you can, it's trying to show that, for example, for the boars, there were over 400,000 slaughtered, and there were 986 scheduled tests for residue sampling in boars. So overall, that's the scheduled sampling. That's not really a large percentage of the overall animals that were slaughtered. But again, they take these numbers and they generate the directed residue sampling based on the risk assessment and the analysis from the previous year's data. And so the market hogs have have shown to have more violations, so that's one reason that they could be tested more, and the sows also. So that's one reason why they may have selected to test more in those categories. This is just showing the percentage of violations is very low. The number of samples that were tested, for example, for the boars and stags was 986, and the number of non-detected residue samples was 976. So the violations, we're not finding a lot of violations in the swine, but they still, overall, the market hogs are making that number come up. If we look at the scheduled sampling, 2008, this is a lot of data, and it just shows all the different animal categories that are going through directed residue sampling, from cows down to rabbits and turkeys, and the young animals that we're also receiving for slaughter. And in 2008, it was about 17,900 animals that were scheduled to be sampled, and there was a total of 20 violations. And then 2009, the numbers are about the same. In 2010, we sampled about 1,000 animals more than we did in previous years, and we still had the same number of violations. So it seems like we are making steps towards the prevention of residue positives, because we slowly are testing more animals, but we're not finding any more violations. So hopefully our education and the HACCP systems are being designed to prevent these residues from occurring. There is, for the National Residue Program, there's a blue book and a red book, and essentially these are books that are online that are free for the public to access. The blue book describes the agency's National Residue Program, and it has links to the plans over the past several years. And based on those plans, that's what determines what they're going to direct us to sample. And then the red book explains the chemical residue sampling plans, and then it contains the results from those sampling plans. So those are available to review if you're interested in the numbers. There's also, we talked about at the beginning, FSIS, where the regulation authority comes from. We also have a lot of policies that are based on the Federal Meat Inspection Act and that are based on those regulations. So we have directives and we have notices. There are directives like this one that goes right to the detail of how to perform the residue sampling and the verification procedures to perform in accordance with the National Residue Program. We have the directive that advises and instructs veterinarians on antemortem inspection and postmortem inspection, so that they are recognizing those animals that they should be testing. And then this year, and especially in the last couple weeks, we've received some new notices regarding residues. Notice 12-11 it just provides instruction to the public health veterinarian on actions to be taken whenever they find out that an establishment does have a residue violation from the same source supplier. And when we talk about a same source supplier, that's anyone, that's any farm or cell barn where they've previously been notified of having a violative residue level in an animal that was presented for slaughter. And FSIS maintains the same source supplier residue violator list. It's updated at least weekly, and on this list it contains the producer's information, it contains where the animal was found when they had that residue violation, and it's available to the public. And so it is a way for the establishments and the plants to also know and be responsible for recognizing when they could be receiving shipments from suppliers that have had residue violations in the past. A repeat violator then is anyone that has more than one positive violation within a year, and it's a 12-month rolling window. So in the instance that they are a repeat violator, that's when the FDA comes in and investigates that supplier and takes enforcement action. When we look at the terminology, we talked about the same source supplier and the repeat violator. The same source supplier may be a repeat violator, but it's not until they become the repeat violator that the FDA steps in and investigates them. So it's reasonable that a cow might end up in a herd that's scheduled to go for slaughter, might accidentally end up in a herd and test with residue levels. But it's the ones that continually are submitting animals that are testing positive that the FDA is going to step in. There are two other notices that I'll just mention briefly. 1311 just came out last week, and this notice is kind of to encourage establishments that do not have a HACCP plan in place where they are able to trace the origin or the herd history of an animal that tests positive for a residue. This is to encourage them to get that program in place immediately. And what this notice encourages implant personnel to do is to increase the number of animals they are testing in Bobville facilities and in Call dairy cow facilities, because that's where we're seeing a big increase in the residue violations. And so this notice was put in place as kind of an incentive to establishments that if they put a residue program in place and they follow it and they maintain compliance with their program, that we will test animals as we see suspect animals. If they don't have any controls in place, then the implant personnel are really going to increase the number of animals that they're testing because there's nothing in place to prevent the residues from occurring. And when we talk about things in place, that could be affidavits from the producers, that could be medical records, something that will provide the traceability to that animal. And then 1411 is a really it was a surprise, because for years there's been residues that have been identified and tissues submitted, and the drug that was identified was not on the violation list. It wasn't on the FDA's or EPA's list of drugs with tolerance levels. They had not established tolerance levels. And so this notice came out so that any drug compound that is found in animal tissues that is not listed as having a tolerance level, that carcass and all the parts will be condemned. So prior to this notice, it would be a case-by-case basis, where if a drug was identified for which a tolerance level was not established, we would call the technical service center or call a higher authority for guidance, and now they have this in place. So I suspect from this that a lot more animals will be condemned. I mentioned the residue violators list, and it describes here that it has a list of the individuals or firms that are responsible for the repeated drug violations. It's updated monthly, and it's accessible by the public, and so it's a good aid for identifying residue history, and it maintains a cumulative list. So FSIS has recognized that there's a need to monitor certain establishments. There are certain establishments out there that continue to have repeat violations, and so the reason that they're having these repeat violations is because they are not reassessing their HACCP plans, and they do not have adequate measures in place to prevent that. So that is one challenge, and that's one area that we really need to work on, is getting all of the establishments to have a HACCP plan that is implemented and functioning as intended. In the case where you do have these establishments that have the repeat violators, then it's a chain of command that we follow till it gets to the district office, and so it starts with the inspector in charge, it goes to the frontline supervisor, and it doesn't really stop there. The district office is notified of what's going on, and the PHVs are responsible for sharing all of the residue information that they know and for helping the establishment get something in place. And so they hold a meeting and they document it on a memorandum of interview that the establishment has been informed that there will be increased testing of the animals that are being received at that establishment, in hopes of encouraging them to adopt some type of preventative measure. The residue control in the HACCP environment, this was all outlined in a Federal Register notice in 2000, so establishments have had plenty of time to implement this. And essentially, if the establishment adopts the best preventative measure practices, which are outlined in this Federal Register notice, and that includes that they have residue controls that constitute the best practices for their slaughter in the HACCP plan. They implement those controls. They supply FSIS with the producer information when we ask for it, which means that they have to collect it at the time they receive the animals, and that if, in the event that they do have a violative residue, that they immediately implement corrective actions, then they will not receive noncompliance reports. But when they do not have a HACCP plan that's in compliance, then that's whenever the enforcement actions will take place. And that's what this slide is basically saying here. So that was an overview of the policy, of what we're trying to do in FSIS, and some of the challenges that we're facing. And a lot of the smaller establishments that may not have a permanent IIC, that have not had the opportunity for the HACCP education, those are the ones that we really struggle with and are working with now to try to prevent the repeat violations.